Navtemadlin is certainly getting a lot of attention at this ASH meeting because it has two oral presentations, one on the very compelling correlatives from the Boreas trial and one on the clinical data. This is a very interesting and very potent agent. Clearly, it would be really the first MDM2 inhibitor to really to an advanced stage of development in MPNs. We've studied other drugs like Navtemadlin and Prithviraj in MPNs before, but the development of those has not gone forward. Navtemadlin certainly looking very good currently in phase 3. This is the POIESIS study. These are in suboptimal responders to ruxolitinib, where in a very unique design, you actually consent patients who are JAK inhibitor naive. You start ruxolitinib, and then after a certain pre-specified time point, if they do not meet what we consider an optimal spleen response and an optimal symptom response, if they don't meet both of those, that's when they add Navtemadlin or placebo. So this is the only trial of its kind that's been done designed like this in the field. So certainly that's going to be very interesting, although it is going to be a lot of patience and a lot of time that will be needed for because of its design, considering that those who do not have a suboptimal response will certainly not go forward. They're not going to need the addition of Navtemadlin or placebo. So there will be a significant drop off in the numbers. So large numbers will have to be accrued in order to get the requisite number of patients to randomize. So I think certainly an agent being closely looked at, and really a lot of anticipation around this. I should say that in a small study that was presented at EHA, I think 2 years ago, we saw some data in the suboptimal setting on this agent, and there was the response rate was 32% for both spleen and symptoms in the suboptimal setting. So we are starting out with a drug that sets a good benchmark for efficacy, and it remains to be proven in the phase 3 setting.